Thank you very much, Minister. We really appreciate your help and you being here with us today. Without wasting more time, the next speaker is the chairperson of ICPA, Mr. Sham Moodley. He asked me not to read his bio for the time constraints that we are having. Thank you, Mr. Sham Moodley.
Thank you, Chair. Good morning, everyone. Honorable Minister Zweli Mkhize, President of the Pharmacy Council and Vice Chair of ICPA, Mr. Mogolo Pasha, the Head of Legal Services at Pharmacy Council, Debbie Hoffman, the CEO, Mr. Ivan Kotze of the PSSA, Joe Ravele of the SAACP, ICPA members, special guests, and supporters from the trade and industry. I greet you on behalf of the Board of Healthcare, Board of Directors, and staff of ICPA. We hope that each of you will be inspired in some small way at the end of these 2 days to help create a South Africa where universal health coverage is a guarantee for each of our citizens, and that independent pharmacy will take its pride of place. Our young democracy is facing many challenges in various sectors of society, and certainly more critically in healthcare. We must agree that whilst great strides have been made since apartheid, we nevertheless continue to have a poor functioning healthcare system with shortcomings in significant aspects of care in both the public and private sector. We may choose to be critical, assign blame, and hope that the system rectifies itself. But the new South Africa was not built with this in mind. We struggled through some 350 years to guarantee universal suffrage, and we will probably struggle more and even longer to achieve the dreams of the likes of our late President Mandela and others. When the Friends of NHI was being announced last week, I was on a trip to the beautiful country Ireland, where I studied in the 70s and 80s. Being inspired by the likes of Prof. Khader Asmal and regular visits from Oliver Tambo and Mac Mirage to our student association in Ireland, I followed the Irish struggle for emancipation closely. I visited this peace wall of Belfast, constructed as barricades during the intense battles in the 1969. These 6-meter high walls, some extending 3 to 4 kilometers, continue to drive Catholics and Protestants apart, the Irish nationalists looking for a united Ireland, and the loyalist supporters of the British Empire. The reason I tell this story is that Eugene, the guide during this tour, made a profound statement. He said, "Those that live outside the area will never understand and appreciate the value of being in a united nation and having a vote in your own country." It immediately brought me back to home. Those of us that can afford healthcare needs to understand and appreciate that what it means to not have access to this basic human right. We are compelled ethically as healthcare professionals to fight to ensure equitable healthcare for all. While there are discussions around the technical issues of funding, complications with design, and the issues of feasibility of the NHI bill, ICPA has taken the view that universal health coverage and NHI is essential for patients' rights, and the point of view that we carry is not unique. I think a lot of our citizens require this. It is essential then that any discussion around a 2023 plan in pharmacy must be based on the acceptance that it will take place within the framework of a national health insurance and universal health coverage. We are also critically aware that this ambitious plan being launched in the midst of issues of state capture, the poor performance of our SOEs, and more importantly, the pains suffered by millions of South Africans in their attempt to access healthcare. We are hopeful, Minister, that under your guidance, the necessary safeguards will be effected, a turnaround strategy is in place to improve public health, and that private health is controlled to ensure that funding is adequately spent at the point of care on professional services and patient outcomes, rather than in providing shareholder value. It is within the framework of social justice and our passion for healthcare that we support the philosophy enshrined in the National Health Bill. Our patients cannot be denied because of our inefficiencies any longer. 40 years ago, the world committed itself to health for all in the Alma Ata Declaration through primary healthcare. While there has been many advances in healthcare since then, we remain far from this dream. It is hoped that the political commitment shown in Astana in Kazakhstan in October of last year in 2018 at the Global Conference on PHC, this will reinvigorate the need for primary healthcare as a possible solution. Clearly, pharmacists who practice at the heart of the world's communities must form a key aspect of this delivery together with other primary practitioners who become then gatekeepers in our community. In our first input to the Green Paper, we presented valid research into how pharmacists could play a more meaningful role in changing the course of some of the disease profiles in South Africa. We note, with a little bit of disappointment, the introduction of the CCMDD model that excluded initially the critical PHC role of the pharmacist. The WHO, just 3 months ago, signed a memorandum of understanding with the World Pharmacy Representative Organization, that is a Federation of Independent Pharmacy, to evaluate collaboration, affirm cooperation on strategic priorities. We hope that our interaction today will go a long way towards strengthening this goal and assist in changing the mindset within the National Department of Health. The MOU signed in Geneva talks to the strengthening of pharmaceutical systems, announcing the role and impact of pharmacists in promoting health-related human rights and gender equity, and enabling better access to and the use of quality, affordable medicines for universal health coverage and PHC through those most qualified to handle it, and that's the pharmacist. What then will pharmacy be offering in our Vision 2023 as we work our way to achieve the 2030 Agenda of Sustainable Development? Firstly, the ideal location of pharmacy in urban, peri-urban, and rural area is a key delivery for PHC. Secondly, Jackie, if you can just change that slide. Secondly, the services that we outline in this document, which is part of our NHI submission on the Green Paper, talks to essential services, advanced services, and local advanced services. These are practice models that are already in place, and we've offered that as a solution towards the PHC outcome in the NHI paper. The next slide, please. In terms of primary health care, we are confident that together with other healthcare professionals, we could provide solutions jointly in joint models to take care of communities. In terms of minor ailments, to put together a strategy to ensure that these conditions, these minor conditions, are treated at a pharmacy level rather than them entering into the GP rooms or into tertiary healthcare. The new emerging pharmacy services used to optimize medicine, used for medicine optimization, would be part of our strategy to ensure that no more damage is done using medication in the wrong way. Clinic services, which you've already alluded to, Minister, in terms of the project that we are doing in the Western Cape, where licenses have been granted for family planning, sexual health, baby immunization, and wellness management. Minister, pharmacy as a profession has gone beyond the point of being critical and has launched the NHI Pharmacy Consultative Forum almost a year ago. This is an attempt to formulate a comprehensive plan that will be shared with the National Department of Health. The organizations across the sector, from manufacturer to patient, have been included in this consultation process. The objective of this would be to create a comprehensive document outlining various roles for pharmacy, to allow for standard setting, quality control, and measurable outcomes, to explore new models of care, and to provide a comprehensive narrative to the future of NHI. We hope that you will take cognizance of this document when it's ready in the next 4 to 6 months. There are, of course, barriers and changes that may be required to ensure success, and let me just outline them for you. The first, one of the areas of concern in strengthening our pharmaceutical system that we have repeatedly raised is the issue of ownership of the profession of pharmacy. In 2004, ownership was opened with the precise intention of allowing laypersons to open pharmacies in areas of need to expand the PHC network. It has unfortunately had the opposite effect. We have multiple pharmacies in shopping malls, in affluent suburbs, mostly owned by many corporate pharmacies that are now in place. It has also had a detrimental effect on existing community pharmacies, and it has also removed the opportunity for young pharmacists, especially those from disadvantaged communities, to become owners of their profession. We started with 3,800 pharmacies prior to the regulations. Those numbers have remained stagnant, with the only change being that almost 50% of prescriptions, once done by community pharmacy, now flows through the corporate hands. As part of Vision 2023 for ICPA, we want to ensure that every community has a pharmacy within 5 kilometers from their home. We therefore urge the National Department of Health to reevaluate this 2004 legislation with a view to realignment of its original stated intention. We propose that we find a way for all community pharmacies to be classified as PHC centers, offering the baskets of services funded appropriately by NHI. We believe that the change of legislation and the support of government through the SMME concept, there could be an additional 2,000 PHC pharmacy centers adding to the NHI infrastructure within the next 5 to 10 years. This will also help to create approximately 20,000 jobs for the country, making available a pool of healthcare professionals registered with the council for NHI. This should easily form your contracting cups that you talk about to deliver pharmaceutical services. 36 million people die annually from non-communicable diseases, according to the WHO, representing 60% of deaths worldwide. NCDs have had a significant impact on healthcare in South Africa, and this has been dominating the headlines. We clearly require new, innovative, and creative solutions in this regard. Ideally, there should be a program of action starting immediately with at least the medical aid schemes allocating funds outside of the dispensing fee for pharmacists to perform primary care activities such as prevention, screening, early detection, appropriate referral of patients on NCDs. In many countries, pharmacists are part of the solution to combat cardiovascular diseases, diabetes, asthma, COPD, and cancer. Pharmacists should provide disease management and pharmaceutical care aimed at improving treatment outcomes, promoting adherence, minimizing medicine-related problems, and ensuring healthy lifestyle for patients with non-communicable disease. As we work towards 2023, it is our belief that no medical scheme should be registered without having all of these essential services that will contribute to the reduction of the burden of diseases. The minister has to catch a flight, and he did promise to stay till 10 o'clock. So, Minister, you are excused. Thank you so much for your presence here today. I thought I'd be able to get all my important points in that very short time. Let me handle that remote. Thank you, Jackie, for assisting with this. I was trying to run through it. So let me continue without the minister. But what we'll do is we'll send him a copy of this presentation. So as I was saying, in many countries, pharmacists are part of the solution to combat cardiovascular diseases, diabetes, asthma, COPD, and cancer. Pharmacists provide disease management and pharmaceutical care aimed at improving patient outcomes, promoting adherence, minimizing medicine-related problems, and encouraging healthy lifestyle for patients with non-communicable diseases. As we work towards 2023, it is our belief that no medical scheme should be registered without having all of these essential services that will contribute to the reduction of burden of the non-communicable diseases. It is already provided for by the South African Pharmacy Council in their board notice, but totally ignored by the Council for Medical Aid Schemes. The most frequent cited barrier to the expanded role of the pharmacist in non-communicable disease profile is the lack of financial support from both the public systems and the private third-party payers. The professional service related to the function of dispensing, as defined by Council, cannot become a bartering tool based on perversities through vertical integration and fees for product listing on shelves. Essential to the future of pharmacy is health technology. By 2023, we would like to see a unified system that allows the sharing of electronic health records. Some 47 countries already have this. In Brazil and Netherlands and Sweden, pharmacists are able to interact in the system, not just looking at records, but to alter that records for other healthcare professionals to use as well. Decision-making in pharmacy without this essential service sees pharmacists perform their role almost blindfolded. Clinical decisions on kidney and liver functions, drug interaction, allergies, and even split of chronic and acute medication by different service providers, whether it be courier or community pharmacy, creates room for multiple errors and the loss of lives. A fully integrated electronic health record will be a key enabler in unlocking the potential of community pharmacy to deliver more advanced clinical care, integrate and improve flow of information, improve patient safety, and reduce costs. What we really require is the standard guidelines that the department has been promising for the last 4 years. There are some additional game changers as we head towards 2023. An area in which pharmacy has performed poorly, I'm glad the minister is not here now, I'm going to criticize you guys, is in the area of Schedule 0, 1, and 2, under the banner of pharmacy-initiated therapy. This has unfortunately become an over-the-counter issue in terms of medicine, and has in part contributed to the country's opioid addiction. While the task team is hard at work trying to find solutions together with the manufacturers of these products, we must become more vigilant in how we handle these medicines at the community pharmacy level. The solution being suggested by ICPA is that we create the minor ailment program where appropriate intervention in the form of algorithms is put into practice for pharmacists to take charge of these medicines. You will be surprised at these stats. These groups of medicines make up 76.2% of the total volume of medicines that we dispense in the private sector, whether it's on prescription or OTC. The second is clinic services offered in community pharmacy. And this is a topic that is going to be discussed extensively with a complete model by Siddiq Tayyub on our agenda later today. Jackie Mayman, our CEO, will provide the details about a joint venture initiative that we've put together with the South African Clinicians Society, and we've successfully, we've been granted this, applied for a $1 million grant to train pharmacists to become involved in expanding the HIV and AIDS services in South Africa. This, we believe, will speed up the 1990 target that the Minister is looking for. So to summarize our 2023 vision, I think these are the areas that all of us in pharmacy, owners of pharmacy, people that are involved, need to focus their minds on. First would be the collaborative practice model that the NHI is talking about. So within your community, it doesn't have to be in the same location. Apparently, we could integrate it via an electronic system, but work in a collaborative practice using the digital space. Disease management in terms of advancing our role in clinical care, preventative health, especially around patient education and screening, where we are expecting schemes to come up with a plan to actually pay for these services. It cannot be continuously done for free. Medicine supply chain specialists and availability of medicines. We believe that the CCMDD model, as much as it has decanted in the state, it is not an ideal system. I think those preparation of those medicines, the interaction with the patient must be done at a pharmacy level, not at a courier system level. The rational use of medicines and the development of formularies towards an NHI. We need to start with various sectors of pharmacy coming together and saying, what should be the formulary for an NHI? Is it what we have? Should that be expanded? But I think we have a role to play there. The next would be our role in antimicrobial stewardship and trying to reduce the issue of resistance in this country. Then the adverse events in terms of ADR reporting, error reduction, and trying to save lives in that way. And lastly, our clinics, the way we utilize that, the way we utilize our pharmacist skill in pharmacy-initiated therapy in terms of the minor ailments, and then the authorized prescribing, using those pharmacists, especially in the outlying area where there are no services, to become an integral part of NHI. This picture is actually the old library at the Trinity College in Dublin, and it actually hosts the Book of Kells, and it was really an emotional experience to walk into this room. So I want to take you back to my Irish story. So as a young foreign kid, I was 17, 18 when I got there on a United Nations scholarship in the late 70s. I'm giving away my age now. I was very fortunate to be the recipient of two things. One was a study visa at University College Dublin, and the second was a medical aid card which provided me with full access to essential healthcare as well as insight into the experience of being a benefactor of the Irish NHS system. I had access then to a few GPs in my area that I had to select, 2 private pharmacies that I could use either one of, a couple of dentists and other service providers, and a local hospital. So that was what was allocated on my NHS card. In the 1970s, Ireland was one of the poorest countries in Europe. I learned then that such a system has merit and could indeed work and could be inclusive. So my last slide, I would like to, Jackie, you're sleeping. I'd like to quote the late President Nelson Mandela and say that it always seems impossible until it is done. So I do believe firmly that it can be done and that independent community pharmacy will be ready for NHI. Thank you very much.